time. Great. So, good afternoon for those of you who are in London. Good morning for those in the EST time zone of the world. This is the second edition of the ACSIS Exchange webinar. Today we'll be focusing on the health and life sciences sector. I'm David Roberts. I will be your moderator for today. For those who know me, I have been an entrepreneur, publisher, and event convener for several years. I'm known for the blog caribdirect.com, for also creating the Caribbean Food and Drink Conference and the Just Caribbean Festival in 2018. So, welcome, as I said, to the ACSIS Exchange webinar series, which is a timely and urgent dialogue exploring global relevance of African and Caribbean leadership in today's shifting geopolitical landscape. As the world contends with the resurgence of Trump-era policies, including renewed threats of immigration bans targeting African and Caribbean nations, and escalating climate change pressures, the ACSIS platform offers critical insights into how our regions can shape resilient, sustainable futures. The Health and Life Sciences sessions together brings global thinkers, life coaches, investors, and policymakers, amplified by global health crises, exclusionary policies, and restricted mobility, impact access to innovation, medicine, and opportunity. At the intersection of trade, climate, and equity, we ask, how can Africa and the Caribbean act boldly and collaboratively to protect lives, build capacity, and ensure sovereignty over their health and development agendas? The world is watching, so be part of the conversation. So I'd like to introduce my team. Well, actually, I am introducing my team. So we start with Dr. Michelle S. Mosley, who is a consultant, coach, and educator, a versatile financial consultant, educator, and life coach, professional expertise in advanced consultation strategies, investment advice, and retirement planning, and all aspects of life coaching. Dr. Uche Igwe, political economy analyst, who will be joining us very shortly, is a visiting fellow both at the Firoz Lalji Institute for Africa at the London School of Economics and Political Science and the International Center for Policing and Security at the University of South Wales. We have our esteemed producer who is ensuring that everything goes smoothly today, in the person of Madison Tavares. She's a dedicated Caribbean person, originally from the island of the Bahamas. Her storytelling expertise will help elevate ACSIS's global impact and foster greater inclusion in its narratives. And last, I have, and not least, of course, my researcher, who is very instrumental in making this series possible. And she's a senior campaigner manager with 10 years plus experience, delivering global brand campaigns, driving audience engagement, and leading purpose-driven marketing strategies across sectors including finance, jewelry, and regulatory communications. And this person is Atinuke Akintolu, our researcher. So, the person who we are all here to listen to today in earnest is none other than the veteran NHS Health Informatics expert, Steve Maingot. Steve Maingot is a healthcare leader with extensive board-level NHS and voluntary sector experience. He specializes in health informatics, commissioning, digital transformation, and strategic leadership across all levels of care, driving innovation and equity in health systems. So welcome, Steve. And just to do a bit of housekeeping, for all of those who are interested in writing questions or sending questions through, you can send them through the chat. No need to raise your hand. Once the questions come through on the chat, we will take them into consideration. So without any further ado, I shall introduce and allow Steve to take the floor. Steve, over to you.
Okay, David, thanks very much for the introduction, and greetings to you all. My presentation is going to be centered around the impact of Donald Trump's 19-country ban on African Caribbean countries, and then we're looking at the Health Informatics spin-out from that. By way of introduction, the purpose is to discuss how policy decisions affect health and community well-being. The travel ban overview implemented on the Trump administration, which affected 19 countries, and then the significance, the impacts, global mobility, healthcare access, and economic well-being. In understanding the travel ban, they began with the executive orders, which restricted immigration and visas from selected countries. Then you have affected nations such as Nigeria, Sudan, Eritrea, Tanzania, and other with a large diasporas. And then there's the official rationale, which is national security, vetting concerns, and foreign policy agenda, which is the driver that led to these executive orders. So what is the health implications? Well, there is a medical care access. Patients unable to travel for life-saving procedures, medical education impacted by training and residency programs blocked. And then thirdly, public health collaborations impacted by disrupted programs with US health institutions. The broader health implication of all this is one, the environmental factors. Reduced collaboration increases vulnerability to air and water-related diseases. Then there is the lifestyle consequences. Increased stress leads to hypertension, depression, preventative care access diminishes. And then thirdly, the medical consequences. Interrupted treatment, form of TB, tuberculosis, and HIV due to travel restrictions, examples. So what is the role of health informatics in all this? Well, first of all, there's a digital solution. Electronic health records and telemedicine mitigate access challenges. Then there's diaspora connections, digitally linking health professionals with affected communities. And then thirdly, there is the practical applications, remote consultations, health tracking apps. And then fourthly, artificial intelligence or AI integration, which allow predictive care models, improve treatment plans. So lifestyles and socioeconomic effects. The economic disruption led to remittance drops and halt business ventures. The cultural limitation leads to reduced educational and familial visits. And then thirdly, the psychological toll is the isolation and trauma within diaspora families. So global and local responses to the travel ban has been legal challenges initiated, courts and advocacy groups launched legal actions to oppose restrictions. Support networks form, alternative visa programs and robust local communities assistance emerge to aid those affected. Digital adaptation accelerated, communities swiftly adopted teleeducation and foster virtual entrepreneurship or to overcome barriers. So moving forward, overcoming the challenges, first is to expand health informatics use, strengthen the regional collaboration, and empower diaspora leadership. Individual contribution, support advocacy organizations, donate to health funds, and engage in digital volunteering. And the policy recommendation, therefore, is promote inclusive and immigration policies, reinvest in global health diplomacy, create healthcare, and exchange programs. And now open to questions.
Okay, the floor is open. Anyone has any questions that they'd like to ask at this point? Sabrina, anything you are curious about?
Yes, I was typing to drop it in the chat, but I've put it there, but happy to ask the question directly as well.
Yeah, sure. Go ahead. Go ahead and ask.
I had a couple of questions. So the first question was what I put in the chat, which is, what role do you see the private sector playing in overcoming the challenges that you refer to, both within the tariffs and then the impact to the nations as a
I
result
think
of the policies?
good in terms of the application of health informatics to effect
Yes.
support the changes.
Mhm.
Principally is working collaboratively with the healthcare professionals via training and development and supporting program and project management with regards to its effect. Now, I work and operate in the United Kingdom, and our experiences is not too dissimilar to the LDCs, the lesser developed countries. And those tend to be the key drivers. And the other matter is the patients or the population as a whole, their responsiveness and the speed at which they respond to the new transition of digital health.
Thank you. I have other questions. Open to those other people, but have other questions as well.
Go ahead.
I really like the idea of creating healthcare exchanges in the slide that you shared previously. Do you think that there is the appropriate infrastructure in informatics set up to enable healthcare exchanges?
I think there is. If you think in terms of the social media, it's a facility which can be used, and in the United Kingdom has already begun to be used. So, for example, during COVID, patients were disconnected from their practices in terms of in-person visits. But through the social media, using SMS, they were able to communicate with their clinicians, ask questions. Um, some have WhatsApp groups that deals with particular specialism, maybe asthma or diabetes, defined groups. You know? So, and that means that that could be done across the entire world. So yes, in short.
Thank you. And last question for me. I'm also based in the UK, and the government has identified life sciences as one of the 8 key growth sectors in the country. Do you think that, and whilst that's focused only within the UK, do you think there is and presents an opportunity for transatlantic partnership and collaboration with the United Kingdom and African Caribbean countries, specifically within the life sciences sector?
I believe so. I believe that is possible. Um, we know from just general medicine training, people who study medicine at St. George's or UE, do get the opportunity to come to the United Kingdom to do senior doctors training in various specialties, right up to the Royal Colleges, whether it be surgeon or obs and gynae. So yes, I think that that would be able to take us forward in creating a much more um, effective support network across the communities.
Great. Thank you very much.
Fantastic. Thank you very much for that, Steve. I am very grateful for the questions that you've asked, Sabrina, and I hope that we've managed to answer them in the way that you had expected.
Thank you.
Great.
Have we got time, or Madison? I've got one question that came in, David, that might be worth picking up.
Okay.
And the question was around what are the key challenges faced by countries in Africa and Caribbean in adopting digital health technologies, and how can these challenges be overcome? So almost following on from Sabina's question earlier on. And in essence, countries in Africa and the Caribbean face several interlinked challenges in adopting digital health technologies, but there are also promising strategies to overcome them. And I'll just give a brief breakdown. So the key challenges that they face, and it's not dissimilar to the developed countries, is infrastructure gaps, limited funding and high costs, workforce readiness, fragmented policies and governance, and cultural and language barriers. Just give a little bit more depth on the infrastructure. So many regions lack reliable electricity, broadband internet, and mobile network coverage. And again, it's not a mile away from the developed countries. They do have broadband internet issues and mobile network, probably less so the reliable electricity. Limited funding and high cost. The initial investment for digital health systems, hardware, software, and training is often prohibitive. And that is worldwide. Workforce readiness. There's a shortage of trained personnel in health informatics and digital tools. Healthcare workers may lack digital literacy or resist transitioning from paper-based systems. Global. And then fragmented policies and governance. Inconsistence of undeveloped digital health policies. Hinder coordinated implementation. Data privacy, cybersecurity, and interoperability standards, often seen lacking or unenforced. And then finally, in regards to the cultural and language barriers, diverse languages and cultural norms can affect user adoption and the design of digital tools. Trust in digital systems may be low without community engagement, and this was emphasized during the COVID era. David, these are some of the just one of the questions that came in early on, and the illustration of the issues, and it makes the point that in the developed world, it's no different to the less developed countries experiencing with regards to digital health and transformation and the application of health informatics.
Interesting. Very interesting indeed. One would have thought that with the advent of AI, that things would have been a lot better for first world, if they still use that term, or developing countries in relation to health informatics. But I'm glad you clarified that.
Yeah, not dissimilar at all. There's this engendered fear, resistance to change. I think it's probably a human factor. But I mean, I'm an ambassador at the NHS for the NHS app, which makes significant transformations in terms of patient access to the health records and accessing clinician in a timely fashion. But the take-up is progressing, but it is slow.
Yeah, I think there's a lot of resistance from many quarters in the community, particularly in the African Caribbean community, as it relates to technology. I don't know if one can blame them, but I believe those fears are in some ways legitimate. So we'll see how things progress in years to come. All right. Any other? Sure, Michelle.
Curiosity, I don't know if necessarily it's your department, Mr. Maingot. I hope I said that correct.
Hi, Michelle.
But with the old Trump ban, I'm just trying to understand from kind of my limited understanding on the healthcare side. With the Trump ban, we see all of what the possibilities are. What are the possible restrictions, and what are the possible poor implications or negative implications, I should say. But there's still going to be people. There are people that are in academia. There are people that are pursuing this here. What would be some of the things that you would tell them? Because I mean, and I'm referencing particularly African and Caribbean countries, what are some of the things that we can tell them in this space that they are not completely discouraged? Because if I were one of them, I would be discouraged.
No, you give it the best shot. I think it's really access to the facilities, the exchange programs. So just like they will come to the United Kingdom to do postgrad studies. So that's what they call high specialty training. So you do your general medical degree, and then you think of specializing. And there's where the developed countries come in, because you can go. And that's the challenge that they face with what Trump is putting forward. And in addition to that, the restrictions that he's trying to force regarding Cuban doctors of disbursement across the Caribbean.
Okay, thank you for that. I'm just kind of curious as to the developed countries would have their hands tied somewhat as well with regards to this, but I'm just trying to see what is that we can actually do. And I don't know necessarily that is your department, but it's just one of those things that I've been puzzling about ever since this news came out, is like, what are, for example, I'm in Ghana, and I fully expected that I was going to do some of my, I'm not in Ghana, I'm just saying, giving that example. And I fully expected that I was going to be able to access, these international teaching facilities, let's put it that way, so that I can increase, my acumen, bring it back to my home country, if you will. What do I do in that case? That's what I'm trying to figure out. Like, what do I do?
Well, you still try. You still give it a shot. Don't sit back and say, well, they're broadening these restrictions, so I wouldn't try. I would strongly advise that you try.
Okay.
And you just never know. You could get through.
Okay.
But don't withdraw because of all the political rumblings that's going on. You gave it your best shot.
Okay. Thank you very much. I appreciate that.
Fantastic. Great. Well, Steve, we really appreciate the insights that you've provided with the health informatics and how we in the African Caribbean space have been affected adversely by the Trump policies on banning the 19 countries. We will watch this space to see how that develops. If he concedes to some amount of negotiations from these countries in terms of the impact that it will have on them, or if he carries through in the usual Trump style. Thank you for all the questions that have come through. Now I'd like to move to Dr. Uche Igwe, who will give us his take on the whole situation with health and life sciences. Over to you, Dr. Igwe.
Hello.
We can hear you loud and clear.
Yes. Thank you very much. And let me thank Steve for all the areas that he elucidated. I have a confession to make. I am not a health economist, and some of those things are still flying over my head. But then I want us to spend a few minutes to talk about a few practical political economy issues, especially as it affects Africa, as it relates to the cut in aid. This is a practical slide looking at the decline of the funding. As you know, as soon as the Trump administration made the announcement, it sort of had a multiplier effect on what other continents and other donor countries were contributing. So it had a sort of emergency. There were reversals, for instance. The CDC report referenced in this slide talked about the reversal in maternal child health gains in the last 2 decades, and also issues of direct implications on the death rate. The scary part of it that it may lead to 2 to 4 million annual deaths across the continent, which is very worrying. I just wanted us to flip through these numbers. The multiplier effect that I spoke about as soon as that announcement happened, some other countries, Germany, France, EU, sort of leveraged on that and started also pulling back. Obviously, there was the COVID part of it. After COVID, the whole philanthropy, aid architecture started dwindling. But I believe that it was the Trump administration and their posturing that dealt what I consider the heaviest blow. So you can see the numbers on that slide. And this is again focusing on the major countries that are recipients of US aid in Africa. And you can see my country, Nigeria, somewhere there. Not the first, not the highest, but somewhere the third.
In the middle, yes.
In the middle. And you can see South Sudan out there, and you will see that some of these countries are countries at war. And you can imagine the implication of this reduction in aid to the real issues. And one part of it is that in some of these countries, including Nigeria, reliable data is not available. So even some of the things I'm going to put here, some of the things other experts are quoting are not necessarily reliable. Because in many parts of Nigeria and in many parts of Africa, it's not even accessible because you have to access some of these places, a few of them under conflict, to be able to get the data you require to sort of quantify the kind of implication of this cutting aid could have. Again, expanded slide on the numbers and the disbursements on health. Health alone and Nigeria is still popping up there high up. But Tanzania beat us to it, and you can see DRC, Malawi on the bottom. Again, what it means is that looking at if I wasn't able to get the 2010 numbers, but what it means is that there will be a significant decline in 2024. Sorry, 2024 numbers will be lower, and this is obviously coming from Mr. Trump and his announcements. Please, you can look at this. Out of all of this, 38% on health alone. Let me move slightly quickly. Now, this is probably my most important slide, the possibilities. What do we do going forward? And I talked about probably 5 things. First is that there is a urgent need to increase domestic investment. Domestic investment by countries, they need to spend more. African countries need to spend more, and in doing so, they also need to improve local accountability and ownership. Sometimes the money spent, especially in this part of the world, does not necessarily translate to effective health infrastructure. So one is to ensure that more money is invested. Another is to ensure that the resources invested bring value and they're accounted for and are owned. There's also a need to strengthen local institutional expertise. Gone are those days that Africa will go cap in hand begging for vaccines, and there's a need to foster regional collaboration, and also is important as a response to the Trump policy that Africa should think very seriously and reinforce inter-African trade. I can see that the boss is asking that I stop, and I'm happy to take a few questions at this point. Thank you all.
Thank you, Dr. Uche. Very inciting or insightful information. So we open the floor for questions. I have a question while others consider formulating their own questions. Looking at the way the Trump administration are managing their economy and the processes going forward, it would seem like there is an underlying interest to marginalize the countries of the global south. Is that a feeling that you get generally, or is it incidental that these countries are the ones being targeted?
Well, I think that what is being targeted is aid, and inadvertently, those who are recipients of aid get targeted. So I think that the initial effort, I don't want to interpret it the way it's looking, that countries of the South are being targeted. I think that the first thing he came in to talk about is that aid is bloated, aid is mismanaged, and you know, the whole idea of Make America Great Again is to channel part of these resources inwards, however, whatever that means. So I think that he was basically targeting aid, and those countries who are recipients of aid, as you can see from those slides, become victims. So that's my view.
Okay, thank you for that. The other question I have is about the brain drain. It is well known that Africa and the Caribbean have been in some ways hemorrhaging their skills to the US for many years. Do you think that these actions might reverse that trend and cause people to return to their homelands and contribute?
Yes and no. Yes, because when people are skilled and they believe they have contributions to make, some of these very hostile policies, as they impact on them negatively, they will think about alternatives. But yet, many of these African countries, I'm in Nigeria at the moment, and I am in another city, and I had to work very hard to make sure that I get energy to power this presentation. So having been in, let's say, United States and United Kingdom, for instance, for 20, 30 years, coming to adjust, however, you know, the opportunities that are here. By the way, there are more diseases here. So in terms of opportunities for people to make contributions, there will be more here. But the conditions right here are such that you probably need to think twice. So if African governments have the political will to make the conditions here fairly better, or maybe a bit comparable to what is obtainable out there, yes, some of these hostile policies are capable to trigger a reversal of brain drain. But until that happens, we may still be speculating. One final thing I want to add is also the real economic issues about, for instance, exchange rate fluctuations. £1 is now 2,200 naira. And what that means is that, I mean, when we went to England many years ago, a pound was 150 naira. So being out there and what you earn and what is the equivalent back home, if you have to make those comparisons, you probably want to live from one Western country to another rather than thinking about living from one Western country back to Africa. So those real economic issues do matter in decision making.
Absolutely. Absolutely. Thank you for clarifying that. Are there any other questions from the floor?
I have a question, if I
Sure,
may.
Sabrina.
Thank you. Thank you very much for your presentation, Dr. Uche. Dambisa Moyo wrote a book called Debt Aid a couple of years back where she talked about Africa's reliance on foreign aid. And we're seeing essentially her forecasts in what we're seeing now with the Trump administration. 512 million for Tanzania and Nigeria, respectively, is a lot. And I think it was circa 200 million for Malawi. When you refer to increasing domestic investment, what's your expectation of where you think those domestic investments should come from?
Thanks a lot. The domestic investments need to come from the country. Interestingly, for a country like Nigeria, they have a lot of resources. Nigeria is a resource-rich but poor country, and most of the time, the problem is actually resource allocation and corruption. So when I speak about investment and domestic investment, is actually for these countries to scale up the amount of resources they allocate domestically from their budget into the health sector. Side-by-side resource allocation, in one of my slides, I talked about accountability and ownership. Because in some parts of the continent, resource allocation is the issue, but in other areas is resource leakage. Allocated resources get leaked. So on one side, there is a need for improvement in allocation of resources. On another side is a need, an urgent need to plug the leakages so that resources allocated can bring value and service delivery.
Sabrina?
Just a follow-on question. So I just want to make sure I'm clear. From your perspective, and Nigeria is very resource rich. Other countries are not. So along with the corruption challenges, your position is it's more about the funds are there, but it's about resource allocation across all the African countries. I just want to make sure I'm clear on your position.
No, I gave an example of Nigeria where there are resources, but may be either misallocated or there are leakages. There are some African countries that are not lucky enough to have as much resources as Nigeria. But then that doesn't mean that there are no opportunities for prioritization and local resource allocation. Now, I'm sure you're aware that there's been a lot of focus on domestic revenue mobilization, even through things like taxation. Okay, so those who are not natural resource rich across the continent, they have other things they can put on the table that can be used to generate resources. The whole idea is that we cannot continue to look west for our resource stability and resource mobilization. There are also others who think that if we cannot look west, we can look east. for resource mobilization. But let that be a subject, another conversation.
Agreed. Thank you.
Yeah, absolutely. Yeah, looking east has certain implications that we can't consider. I don't think that this webinar has the scope to discuss that today. So thank you, Sabrina, for those very interesting questions. I think we have time for one more question before we move to Dr. Mosley.
I have a question. Thank you very much, Dr. Uche. Actually, it's a follow-on from your last statement. I just think back to the end of World War II, which actually led to the birth of the NHS in the UK. And I feel like sometimes out of negative situations, there could be a positive outcome. So I'm curious if Africa and Caribbean relying less on America and the West for development aid, does that potentially lead to an opportunity for us to look inwards, relying on each other, and look for opportunities to solve this ourselves?
I think that if you look at the slides, you know, it's not as though we have options. Our options are limited. These resources that are generated from aid fill in the gap here and there. Now, because there was no prior notice, there was no preparation, there was no transition, and boom, it all happened. That means that we have two options. Option one, seek alternative sources, including domestic mobilization of these resources. Option two, be able to allow 2 to 4 million Africans die from preventable, treatable diseases like HIV, tuberculosis, and you know, deepen our mortality rates, child and maternal mortality rates. So if you ask me, our options are limited. Option one is, in my view, the only option. Look elsewhere and then look inwards.
Interesting. Atinuke, does that satisfy your curiosity?
Yeah, thank you. Yeah, I think I'm for looking inwards. Yeah.
Well, I think for me, the last point I have on that is there may be a need for a paradigm shift, not only in Africa, but also in the Caribbean, in terms of how we see ourselves in the grand scheme of things in terms of global economic advancement and development. This reliance on the West has to stop. We have skills within our communities and our societies, and we need to trust each other more, in my view, in order to take advantage of the opportunities that are being created by the Trump administration. For some reason, everybody is waking up now, you know, whether it be by force or they see the inertia and they realize, hey, this is time for us to make a change, to take control of our destiny. So I believe strongly that this is a real opportunity for us to make a difference for our people. Great. So having said that, I will now introduce Dr. Michelle S. Mosley, our life coach. She will be speaking on bridging gaps, coaching conversations in the context of the health and life sciences sector. Michelle, over to you.
Thank you so very much. What a very powerful conversation. And I am inclined to agree with Dr. Uche, where he said that it is going to be, it's pretty challenging. Where we're going to kind of, I guess, separate ways a bit on this is that I understand that right now the challenge is that we, when I say we, I'm talking African and Caribbean countries, we don't have the resources right now. And so what do we do? Do we allow all of these people to die, or do we look elsewhere outside of the Trump scope? Let's put it that way. And I suspect in you're right in some degree, to some degree, but I also suspect, like David said, we have to have this paradigm shift where we got to kind of look out for ourselves. And maybe this is a way for us to do that. And it's not going to be easy. I think it's going to be extraordinarily challenging, but I think it has forced us to look inwards a bit more, not that we're ready to, but we have to, we must. And so one of the things that I believe personally, in a very simplistic way, is to have those coaching conversations. Listen, I am not a health professional. In fact, everything that I've done to date has always been about the financial side of things. I was stock trader and financial advisor and financial planner, but I also like the idea of being able to sit with people and have conversations around what it is that we can do to empower ourselves. And I think coaching of itself, having those conversations, can be that powerful catalyst in health and life sciences in both the African and Caribbean communities. We have to address things like the systemic gaps. We have to empower individuals more than ever with this kind of ban. And how do we do that? I think it's going to be really, really important for us that are in the diaspora to take some of that reverse brain drain that we're talking about and take some of back into our home countries in order to make this happen. So, hey, I'm just going to blow through this here, because to some degree, Mr. Maingot, and I'm sorry if I got that wrong. I wasn't too sure if you were Dr. or Mr., but I'm going to kind of err on the side of caution and say that did talk about, all of those people that are in academia, those people that are looking to be in this health and life sciences, that they should keep trying. And I agree with that as well. And one of the ways to have them keep trying is that we have to empower them. We have to let them understand what are some of the things that they need to do in order to still keep in the game, if you will. So we have to do things like the leadership development. And again, the onus is going to be on on us in the diaspora who has that particular expertise. We have to show them things like how to, develop leadership, how to look at things like burnout, because that's going to be a big factor when people realize that I'm talking about those inwards, those living in those countries affected by the ban, when they realize that a lot of it will fall on them in order to make sure we don't have the dire consequences of, I think Dr. Uche said 2 million Africans dying from treatable diseases. So we're going to have to look at it. I think that's where coaching will come in very, very important, let's put it that way. And of course, if we're going to talk things like career advancement, you're thinking, oh, we're talking career advancement when we're going to be lacking the opportunity to get those skill training. And I can't reiterate it enough to say that that will come from, of course, the diaspora. How do we strengthen the health systems? How do we look at things like promoting organizational effectiveness and, having innovation and research translation? Every single one of these things will come from us taking information that readily exists outwards. I know we have a ban. I know we can't actually have them go there. But what about the resources that were already in those spaces, taking that and bringing it back inwards as we do that kind of assessment for our inward needs? And of course, I think, again, it was Dr. Uche who talked about the government. And this is where policy advocacy is going to come in, because if the government, and they will have to, quite honestly, be part of the solution in terms of making sure that the policies that are being implemented within the African and Caribbean countries that will have direct impact on how health and life sciences vision and messages and make them more effective, make them more of an advocate, if you will, for systemic reform. And again, looking inwards. We can't do anything else at this point, as the Trump administration has shown us, but look inwards. This is why I was asking Steve Maingot, how do we keep people in the game? How do we keep, academias and those people that are in that space? How do we keep them in the game? And I like what you said. You have to keep trying. And I will submit that one of the ways to keep them trying and to have them understand that they have to keep trying is to have those coaching conversations that will encourage, uplift. And as simple as it seems, and I remember when I was doing my master's and I was looking at coaching, there was a lot of conversation around, Michelle, what is this fluffy thing you're talking about, when it comes to coaching? Coaching is fluffy, but it's a necessary fluff. It's an important fluff because every single one of us, I don't care what field we're in, I don't care what is our job, we start from one premise. And that premise is that we are people and that we are going to be subjected to things like burnout, to things like having to pivot, to things like making changes in the direction of our career. And all of those things need to have that coaching conversation that will keep us moving forward or help us to understand when we need to make a change. And of course, we're supporting community-based health outcomes, health literacy coaching. This is going to be more important now than ever. Coaching can help community, health workers and patients understand health information. Right now, people are quite possibly, those who understand the ramification of the ban, they are possibly going to be in a bit of a panic. We have to help them understand how we could, with our internal resources at this point, manage chronic diseases. I know it sounds simplistic, and I know that from a natural or I want to say maybe from even from an academic perspective, that yes, we have to give them the reality that we do still need those outside help. But all I'm saying, and again, going back to you, Dr. Uche, when you talked about maybe looking elsewhere, I want to say that when we look elsewhere with the understanding that it's not permanent, because I think that's what was wrong with when we came out of African and Caribbean communities. We went to these places and never really looked back. And that means that we look at it as a permanent solution, being outward, staying out from where we are. I think these kinds of ban right now makes it very, very important for us to take a step backwards and say, hey, look, let's look inwards. And one of those ways to look inwards is to take those elsewhere, resources, those elsewhere training, and bring them back. So you're sending out people out there with the intention that they will come back. In Guyana, from where I'm from, a lot of the times the universities, what they did is they put binding contracts around people who were sent to study. So you had to bring that resources back into the country. And I think it's something we're going to have to look at more and more. I think I'm a bit on a time crunch here. So, I'm not going to go through the driving inclusion and equity. If we have that within our local communities, that's, it's fair to say that we'll handle things a bit differently than having to really focus on DEI. And of course, building diaspora and local expertise. Again, this is just to kind of emphasize the point I'm making. When we have knowledge transfer where the diaspora professionals can coach or mentor local leaders, I think that's golden. And we want to make sure that we understand that coaching can foster relational and leadership skills, which is going to be very important, which is going to be very necessary to guide us on the way forward. I think I'm seeing that I might be out of time. Madison? If not, I will just say very, very quickly here, the coaching conversation is more than ever necessary in this era, because we have to start with us. We have to start with mobilizing and motivating us so that we can begin to help ourselves. Thank you.
Thank you very much, Dr. Michelle Mosley. Very interesting presentation indeed, and relevant, absolutely relevant. So we open the floor to questions. Let's hear them.
Hello again. I have a question.
Ms. Sabrina.
Hi, Sabrina.
And I want to bring together the points that you made in your presentation and also where Mr. Steve, to your earlier point, said earlier. His presentation was about creating an exchange. Your presentation talks about knowledge transfer. And I guess my question to you is, sometimes there are great ideas, but we operate in our silos. And so what is the best way of connecting or being a connection point or facilitating the conversations that we need to have that breaks down silos and drives us forward?
One single thing. The
No,
African
your view. One, two,
no, I'm answering you. I'm saying one
oh,
single
okay.
thing.
Great.
The African Caribbean Sustainability and Investment Summit, and I say that very seriously, even though I'm kind of giggling. The fact is, we need conversations like these that will break down those barriers, that will give us the understanding that we need to come together and work together, and that we have to really commit and believe that we could. I think that's going to be the biggest part of the challenge. I want to give you a little bit of a kind of a different take, if you will. I remember being part of a presentation where the immigration lawyer said, "Hey, you know, if you go to the U.S. and you make a kid, guess what? And they discover that now you're banned forever. All right, from ever applying to go to the US. This is under the Trump era, of course. And what surprised me, and this made me somewhat in that audience, is that people begin to ask if there were loopholes to circumvent that. I think the question should have been, how could we then work together to make sure where we are currently, where we live, make it the place we want to be. And I think that conversation will come from everybody coming to the table, not operating in silos, but coming together and having that conversation. And I think summits like the African Caribbean Sustainability and Investment Summit is part of that initiative. Does that answer your question?
It does. Thank you.
Thank you.
Absolutely. I have a quick question for you, Dr. Mosley. It has to do with the idea of being. This though it may seem metaphysical in nature, but the whole idea of a person understanding who he or she is before embracing the idea of consulting a coach. I think that is a critical thing to consider, especially in this climate where there is so much uncertainty, there's so much distrust. How do entrepreneurs know that they need to be coached or mentored in order to make the right decision in this climate?
Well, I think that's an interesting question. I think the whole premise for when I do coaching, I use a model called the GROW model, GROW. What I try to get people to do, to understand, first of all, is, do you have a goal in mind? Because I'll tell you what, every single one of us, whether we actually say, oh, I need coaching, or we say, hey, you know what, I would like to understand better how I can position what I'm doing so that I can scale it properly. And believe it or not, that is actually your goal. This is actually the beginning point or the starting point of you recognizing that you need coaching. And again, you might not actually put that in that framework, that structure, say, I need coaching, but you will have a question of something that you believe you need to do differently. And so for business people, whoever it might be, in this particular climate, they are quite possibly asking themselves, how could I pivot? What should I be changing in order to make sure that I can survive in this climate? And maybe they'll be able to answer it themselves. But I bet you 9 out of 10 times they may either throw it out in a meeting, throw it out to a person that they're, a mentor. They may not even think of that person as a mentor. Throw it out to a person that they're talking to. All of that are indication that they are ready to explore this and to see how they can survive. And because this is not what business is about. How can they survive in this particular era?
Interesting. One more thing. I want to hark back to what Dr. Uche was outlining to us in terms of the heavy dependence on aid that many of these countries on the continent rely on. And I'm thinking, the question is, the leaders who are responsible for accounting for the aid that goes to these countries, they will no doubt be experiencing something very severe emotionally and psychologically right now as a result of the Trump ban. My question to you is, and this is you, Michelle, how do they grapple with this new approach forward? Because obviously there'll be a number of things in terms of their personal lifestyles that will be affected. And then they've got communities that they've got to answer to. How do they deal with this sudden, some may call it an exogenous shock in these circumstances?
And it's most definitely a shock. And I think it's Dr. Uche who said it was sudden, it was swift, it was immediate. And so for right now, I think for a lot of people within this space, first you have to do is process it. And I think that's where a lot of people are right now. They're, processing, okay, like, what just happened kind of thing. So they're processing. And then the next phase will definitely be what I alluded to before. Now they have to make a decision as to how they are going to keep working, keep scaling within this era. And that's where that whole coaching aspect comes in. And again, I want to make a differentiation here, whether it's mentorship and coaching, because I know we use them interchangeably, but they're actually two different things. So remember I said earlier, so maybe someone is just tossing a question out to, let's say, to Steve Maingot as their, as the person with the knowledge in that area, and just say, hey, Steve, like, what are we going to do right now? Or what can be done right now? And that's an opportunity for someone with the experience, that to be able to say, okay, here are some things that you can look at. Whether it's Steve saying, you know what, you have to keep trying. And I do like that, Steve, because the coach in me likes that. The coach in me likes that. The only other thing that we could do is to keep trying, because that's how we're able to make changes. That's how we pivot. That's how we can go into a different direction to help our business. And this, I just want to be very clear and say this just happens in all manner of businesses and all walks of life. We have things that will be thrown at us, and we have the pandemic. And we had to learn how to work within the realm of that. And we had to pivot. I remember at the time I was the branch manager of compliance at one of the investment firms here in Canada. And we had all of these no-nos about doing things that are digital and signing digital documents, etc. And when the pandemic hit, guess what happened? Every single one of us were rushing towards the same things of signing digitally that we thought were a big compliance no-no. So I'm saying that right now in this era here, every single person whose business is affected by it, and every single person who has maybe a patient, client, whatever you want to call them, that is affected, will have to find ways in order to make that change. And this is where conversations like this comes in handy. And in particular for the African and Caribbean communities, I think the diaspora has such a huge role to play in bringing some of these conversations to the table in the home countries, and make sure they understand it's not the end of the world. It's the end of an era as we know it. But what are the opportunities that we can now take and learn from? And maybe, again, going back to what Dr. Uche said, maybe utilizing those elsewhere, but with, like I said earlier, but not with a sense of permanence, with a very specific understanding that we're utilizing the other to bring it back to our shores, because we don't want to be caught napping again when there's another Trump, because there will be.
David, if I may just follow up on Dr. Mosley. You're absolutely spot on. You identify something that I think tend to be overlooked, and that is the way that the world as a whole reacted to COVID pandemic. And that has been the accelerator for digital health right across the world. In the Caribbean, in Africa, and in the UK, and all at the same time, it identified gaps in those different communities. It also flagged up weaknesses. Yes, the kids to be able to work from home, some had computers, If you take Jamaica as an example, there was a smaller proportion that had and didn't, but they found a workaround. So it's a bit of reflection and drawing on the knowledge that is coming forward. I mean, there are lots happening in Africa. You only have to look at the CNN African output. And there's major, major development taking place, significant. And then there's transfer of knowledge from those of us who are fortunate to be in this part of the world, remain in link. I belong to a global network to do with mental health, and it's truly global. I went to Cape Town 2 years ago to chair a session, and every single country on earth was represented. We shared ideas, and we maintain that link. So it is possible.
Okay, fantastic. Thank you, Steve. So we now open the floor for questions. We've got 10-minute questions. So the floor is open. Atinuke, anything bothering you? Anything you want to ask?
Yeah, thank you. I think this is an open question to whoever can answer. I'm curious if there are any good examples of collaboration between, African and Caribbean countries in health or in economics in general, where we've done it well. I'm thinking of, again, going back to World War II, that brought out the European Union, which has obviously developed to this stage. I'm just curious about, any good examples where there've been really good collaboration that could be beneficial for the future.
If I may, I will say that it has been happening more and more. In fact, I am a part of an organization. We call it the Motherland. It's to that it surrounds that effect, and there are a bunch of us that are part of it. I only recently was added to that group, and we've got people from Trinidad, Guyana, Nigeria, Ghana, a whole host of the other African countries, and so. I think we're there. We're getting there. We're not quite there, I should say, but I think we're getting there in terms of having those collaborations, and in terms of not working in silos, but trying to make sure that we understand each other communities. In fact, I've just been charged with trying to get Guyana to be a part of a cultural event in Ghana in September, based on this same organization. And I think all of this is helping to foster and develop that relationship that I believe was critical to the African and Caribbean communities, so that we can have a bit more of a cohesive approach to things, and so that we can kind of piggyback off of each other, because we're the ones that are the most impacted by a lot of decisions that are made that excludes our communities. And so, yes, to answer your question, I think for my part that I'm aware of, there are those organizations that are sprouting up one after the other, all geared towards fostering that collaborative efforts between these two regions. Does that answer your question?
Yes, thank you.
There are other collaborations taking place between Ethiopia and Barbados. Afrexim Bank, you may have heard, they're doing great things with their regional office in Barbados. Not sure exactly if there is any focus on the health services, but they are doing great things in the region, starting from that point.
I do have another question, which was, I think, more on the health informatics area. What are there any like cultural competencies that play a role when designing inclusive digital health technologies, or anything in particular that affects our communities in this area?
There absolutely is. One of the there was a paper I was looking at recently. The data collection and the provision of healthcare planning and delivery is around the ethnicity. And because of its weakness, and in particular in the United Kingdom, where they allow people to determine what their ethnicity is. And what we get is a mixture of what I call political labels, which are artistic colors, versus ethnicity. So it impacts on the terms of the healthcare provision when you come to do a health needs assessment. So for example, I work with a practice and I ran they have 11,000 patients and I ran the ethnicity assessment and analysis of the patients. And there were over 100 different Black as an ethnicity. It doesn't help in terms of needs assessment. So what you get is Afro-Caribbean are high incidence of hypertension, high incidence of diabetes. But because Afro-Caribbean are cocktail, they will have other illnesses, which will then get sidelined because it narrowed down to that. So yes, it's critical. And I had this conversation with the Organization of National Statistics at the very outset, some 25 years ago, when they started to introduce the element where a patient can elect what they see as their ethnicity.
Yeah.
That is a serious situation. How do you control that? Because you have all these, as you say, cocktails of different ethnic groups coming together, and they form maybe, I don't suppose there's any new breed, for the want of a better description, of human being now, because everybody is just so intertwined and interconnected that other ethnic groups are springing up all the time. So it must be difficult for the health workers or the health service to manage that.
Yeah.
Great. Dr. Uche, any final words? We have a few minutes before we round up.
Okay, I listened to the comments, and I cannot agree more with those who think that whatever we need to do alternative resource mobilization should have started happening yesterday. But now that Trump has already blown the lead, it is important to first quickly think about alternative sources, but ultimately look inwards, mobilize our resources, build resilient institutions, build local expertise, so that we will not be taken by surprise again in the future. So that's my submission.
Fantastic. Well said. Okay, ladies and gentlemen, I think we've come to the end of our second edition of the ACSIS Exchange webinar. It's been an extraordinarily interesting past few minutes. I'm very happy with the contribution of Mr. Steve Maingot, who, as I mentioned, is the veteran health informatics expert from the NHS. His insights into how the Trump administration's decision to ban 19 countries are quite instructive, in that we are aware that there is tremendous fallout from these decisions. They will impact the African and Caribbean countries negatively, and that he has insisted that we cannot give up. We should not give up in the effort to continue to forge forward as a people, to take care of our health in the best way that we can with the resources that we've got. Dr. Uche, who spoke very eloquently about the numbers across Nigeria in particular, and by extension, several other countries in Africa, in terms of the impact of reduced aid going to those countries and how they are faring in terms of their ability to continue to develop. His suggestion that the leaders of these countries look inwards to see how best they can come out of this situation is inspiring and encouraging. Dr. Michelle Mosley, who spoke very strongly about the need for coaching. We have to understand that, of course, we are all subject to different changes in behavior. We're subject to health literacy of one type or another. And she's obviously very passionate about the idea that coaching is taken into consideration by leaders within our space, and that we need to understand the distinction between coaching and mentorship. I thank the audience for the questions that have been posed. The questions have really added value to this presentation and encouragement to the speakers. And I thank my team, who have done a fantastic job in keeping it all together, the producer, Madison, and our researcher, Atinoke. Thank you again. And in terms of a look forward, well, I'm happy to say that our next ACSIS webinar is going to be on Thursday, the 26th of June, and we'll be focusing on reparation, restitution. And we've got some very, very knowledgeable speakers lined up for that. So we look forward to your attendance, and we ask that you keep following us in the social media space for our updates. And I thank you again for your contribution and your participation. And at this point, we sign off. Thank you very much.
Thank you.
Thank you.